But because they use legacy software, they're wasting a lot of the clinicians' time. Before we came, if you look at numbers, the clinicians' productivity was somewhere between 1.5 patient per hour. With our software, they could double to triple it.
My guest is Bosch. Bosch is a CRO at Ummanu Health. Ummanu Health brings digital revolution to healthcare. Nir, please tell us a little bit more about yourself and about the company.
Thank you, Pete. So Ummanu Health is a technology company that focuses on automation of urgent health services. We leverage AI and machine learning in order to increase three things in healthcare services: clinician productivity, patient safety, and patient satisfaction. To increase the clinician productivity, we automate the whole process of contacting a patient and allowing the patient to discuss with the clinicians on time. In order to increase the safety of the patient, we have a very sophisticated algorithm that take into consideration the specific condition of each of the patient, the availability of each of the clinician and the clinician focus, and connecting them at the right time according to the urgency. And in terms of satisfaction, we ensure that the client, the patient is always in the know. You know who is going to contact them, when they're going to be contacted, and if there are any delays or, on the other hand, opportunities to make the appointment earlier, our software does it automatically.
Really cool, really cool. I really like why here, because you bring essentially AI and all the digital innovations for an industry, for a sector that it's not famous for being, digitalized and up to speed. So tell me, before we started recording, we had a little bit of discussion. You were telling me about the scale of how many, those appointments, even in the public sector, even in single countries. How big is, that market? How big is that, the amount of those interactions with patients that your company could help, reduce in how long it takes or make it better?
Well, if you look at the UK market, there are around 300 different interaction, consultations only in primary care between clinicians, GPs, basically, and the patient. And we decided as a bridgehead to zoom in and to focus on the urgent market in the UK. That's basically when you pick up the phone, call 111, and try to get more urgent support for your health needs. And this is a more consolidated market, more focused market with very specific services that are provided by these healthcare services provided to through the NHS 111 service. And there are around 40, 50 different companies that provide these services. Some of them are larger and covering different regions within the UK, and some of them are smaller. And they cover the whole, both remote consultation with a GP, consultation with a clinician, nurse, etc., but also what's called UTC, or the urgent treatment center, in which you can come and visit a clinician face-to-face in hours when you cannot get a hold of the GP.
Really?
And in this 111 space, there are around 20 million calls. But these calls are relatively urgent. They are done by patients that require immediate or relatively faster help. And this is where, the productivity of the clinicians, the ability to provide the service to large number of calls and to, again, prioritize, super important. That's why we decided to focus in this market and to start implementing our technology in this market.
Really cool. So let me try to visualize this. Now, we had December, January here in the UK. The flu was everywhere. NHS was overwhelmed. They compared it to times when COVID was around, with the amount of calls and patients that they had. So how is that software really supporting them? Are they quicker, responding quicker at, doing those consultations, communication with patients? Where is that big that innovation? Where is that big automation? How could you support them with difficult times like this?
So let me tell you about the situation that exactly as you said happened usually during winter time in the UK. One of the CEOs that we have been working with described it as, before Ummanu, I felt like I'm driving a huge semi-trailer in the fog, in the darkness, because there's huge number of calls coming in. There aren't enough clinicians. There are very high, very long queues where patients are struggling to get the immediate response. Of course, the clinicians are doing the best they could, and the healthcare providers doing the best they could. But because they use legacy software, they use more manual calls, they're wasting a lot of the clinicians' time. So indeed, before we came, if you look at numbers, the clinicians' productivity was somewhere between 1.5 patients per hour. Mm-hmm. So they took somewhere between 30 to 45 minutes for one patient. So between 1.5 patients per hour to 2 patients per hour. With our software, they could double to triple it.
Wow.
Yes. Yeah. And that created a huge impact. And why is that? Because usually if you look at the flow, those clinicians were, receiving the long list of patients that are waiting on the screens. They took manually the phone and start dialing the number. In around 50 to 40% of the cases, this patient was not ready for the call, so they weren't answering the phone. Then the clinician moved to the next call. So they were spending a lot of their time, valuable time, on trying to get a hold of the patient. They all, at the same time, they were looking at the medical records of the patients that they are about to call to. So they wasted more time in order to try to understand the medical condition of the patients that they're about to call. But as I said, in many of the cases, these patients were not answering. So again, a waste of time. In our situation, using our technology actually gets all this list of patients. We know the technology knows their specific status. They call the patients at the right order. If the patient answers, they bring them to a virtual waiting room, and they line them up, prioritize them in the virtual waiting room. And then all the clinician needs to do is click the next patient. They click the next patient, and the patient is already waiting for them, ready for the discussion. So they're not wasting time of looking on big list. They're not wasting time on looking at the medical record of a patient that will never answer. Not wasting time on actually clicking the phone number and waiting for them to answer. They always have a few patients waiting for them. And of course, I'm describing here something that is it sounds relatively simple, but it's much more complicated than that, because the software has to know how many clinicians are available. What is their specific productivity? What is their focus? Some of them, as an example, has more of a mental ability to help patients with mental issues. Some of them don't. Some of them, are nurses that can deal with ladies that are pregnant, as an example. So the system prioritize, bring everybody to a virtual waiting room, and connects between the right clinician at the right time to the right patient. By doing it, saving a lot of the time.
Yeah.
So that's about productivity. And as I said, we're able to between double and triple the productivity in that specific service in the UK. When you look at the patient safety, before Ummanu was used, there was a phenomena of what we call cherry picking by the clinicians. Clinicians are like humans, like you and me. Maybe they're more educated, on the specific field, but they are human. So they have a bias or a preference to deal with the patient types that they're more comfortable with. So we are using the software actually eliminated all of it, because the software, quote unquote, forces the clinician to meet and help the next patient in the queue, as opposed to the next patient that they feel more comfortable serving. So we eliminated that bias. We also ensure that we prioritize according to the medical situation and the time to serve, because each of the medical situation has specific guidance from the NHS about how long should a patient with that specific condition wait So our software takes it into consideration and ensures that, the next patient will be the right one. And that's around safety. And I want to maybe share an anecdote, which is by forcing. I talked about the cherry picking, and there was additional benefits to the specific clinician and the healthcare provider, because by forcing, quote unquote, the clinician to deal with cases that they're less comfortable with, we're able to upskill a lot of the clinicians. A lot of the nurses, for example, came to us and said, before we use Ummanu, I wasn't comfortable with dealing with specific cases. Now, when I'm forced to deal with these cases, I educated myself about dealing with these cases, helping these specific patients by reading more, or by actually asking, in the first cases, my colleagues, the doctors. And by doing it, we upscale the whole population, community of clinicians for that healthcare provider. And the third thing that I mentioned was the patient satisfaction. Our software uses automation to continuously help the patient be in the know. We send SMS, we send IVRs, and we ensure that the patient always knows what's going to happen. They're going to be contacted. You're going to be in a virtual waiting room. In the virtual waiting room, they know how long they're going to wait, etc. So the patients are not frustrated, but satisfied, and we can see that in the results of the patient satisfaction survey that our customers deliver.
Fantastic. No, it's outstanding. It sounds like outstanding product. I can now visualize it. I can see that, what it kind of reminds me of, it's a very good sales setup for people that call. Instead of spending time, or do I call and upsell this tablet or phone to this person? It is the next one. It's lined up, pre-dial, person is waiting, right? Because very often the waste of time is actually not on that 20-minute call. The waste of time is what happens between the call. You spend 5 minutes deciding, dialing, and then someone didn't pick up. So now you decide another 3 minutes who you call next, right? And obviously only very good, well-organized people that are chasing those, and especially in sales might work. In healthcare, maybe they not, have the permission from calling those people. So maybe that will take 5 minutes rather than 30 seconds, right? So you resolving this, instead of you trying to make this decision, dial, see if someone picks up, they're ready, right? And what I also hear is they actually really enjoy it, because, the bias may be against me this case or something, I'm not comfortable. And then they start taking those calls because systems decided that they should. And they found the comfort in this, and they actually educated a little bit more, had a few conversations, and now they expanded how they can serve people. So it is fantastic. I hear, so you can single-handedly solve the GPs here and make that so much more accessible. Because obviously everyone knows in the UK here, calling your GP, it is not the easiest way. It is still, we've got 20-minute slot and everyone is calling, and it's loads of people in the queue. Okay, let's move to how you go after those, because you challenged with trying to sell to the industry that doesn't massively scream, I love innovation. I've compared it to salespeople. They love innovation. If something is going to speed them up, they love it, because that means better commission. Everyone makes more money. But healthcare is a little bit different. It's set up, it has been for decades, right? And that's how they operate. So what's been working for you to go to those people, prospect, and really educate them and show them, which is it, digital channel, is it networking, is it events? What's been working for you to find clients and convince them to give it a go?
That's a great question. So when I joined the company about 3 years ago, I had this challenge, or this task, to take the technology and expand it around the world. And as I said, we focus on the NHS 111 services in the UK as a bridgehead. I changed the positioning of the company from Israeli startup to more technology, automation technology, and that focuses not on telehealth. Before that, it was telehealth, but focuses on automation, on safety, on productivity. And by doing it, we differentiated ourselves from the many different telehealth companies that are in the market, that sprang out like mushrooms in the COVID time. But we differentiated ourselves, and we positioned ourselves as a company that focuses, as I said, automation, productivity, safety. That's one. The next thing that we did was to find a partner, a design partner, how the way we call it, that is willing to help us design the technology specific to the NHS 111 market and pilot the technology with them. We found one, with the right management that had the right mindset to innovate and with the willingness to improve the services. We did a pilot with them in which we decided very early on the KPIs that we're going to measure. And as I said, productivity of a clinician with specific numbers we measure before and of course after, the patient safety. And they have very specific measurement for that in the NHS. So we were able to measure before and after and patient satisfaction. We started the pilot, we limited it to 3 to 6 months, and we did it. After the pilot, we saw clear improvement in each of these elements. Initially, it was 60% increase in productivity, significant increase from around 80 to 97% in the safety, and also super high increase in the patient satisfaction. From that pilot, we're able to create a clear case study and use that case study in exhibitions and conferences in order to reach out to those other larger players in the market. At the same time, I had a BD team in the UK. We mapped all the different providers and we start reaching to them in direct marketing, highlighting the names, the impact that they had, and try to reach out to them. We created demos, very, very impactful demo that highlighted the impact, but also the simplicity of the software. Because as you said, a lot of these companies are really afraid of innovation and technology. So we highlighted the impact and the simplicity. And after the first demo, with the first contact person in the company, we're able to get a hold of the more senior people. And with the more senior people, we created innovative, creative commercial model that allowed them contractually to test the technology within their services with very minimal cost, but very high upside. Because if you can imagine, if you can increase your clinician productivity by 100%, you save around, 8 to 10 pounds per consultation. But our charge was around, fifth of it. So the return on investment for them was very attractive. Slowly, we had more pilot and more customers contracting with us, where we were able to show the impact more broadly in the UK.
Yeah, absolutely. No brainer. Well, if you have a chance to actually meet a decision maker and show them those numbers, it's a no-brainer to really test it out, right? You're saving 10 quid, you pay a couple quid, right? Everyone is, because obviously the big challenge that you're solving as well is there are not enough GPs or doctors or on a specific, positions. No, you don't need it, right? We're going to make the ones that you have more productive. And it kind of, it's a no-brainer. Is it difficult to start those conversations with decision makers? And I also want to ask you another question. Do you go to any private providers as well? Do you try to sell outside of, NHS? We've been talking about NHS mostly. Who is other group of your clients or ideal prospects as well? And how difficult it is for you to start those conversations and have a chance to show them that demo you prepared specifically for them, or maybe a generic one?
Initially, it was very, very difficult because, we were perceived as another technology company that wants to sell technology to them. And they have a lot of challenges into the day-to-day. But slowly, we're able to build up our brand, to build up the lead lists. We did, of course, a lot of lead generation. And via the phone calls, where we created a very, very effective pitch of, this is what we do. We already have experience and impact with those providers that you all know about, that are, basically your peers, your colleagues, your competitors. They're willing to listen, as I said. And then we developed a very, very concise and effective pitch and demo that allowed us to move to the kind of each step. Initially, what I realized with these companies, you reach out very broadly. You have someone that is willing to listen to you. It's usually a more junior guy that is more innovative, that wants to drive innovation, to be perceived as the innovator in the company. We talk with him, we demo to him, and he's opening the gates for us to a more senior people, usually either IT kind of technology or operations. You pass through them, and they bring you to the next meeting is with a broader audience of the senior team. That could be the medical director plus the ops director plus the finance person. Then you do a demo to them, and they give you the sign off. We then talk with the CEO and the finance CFO as an example.
Mm-hmm.
We agree with them on the financial, and then we move and talk with the board. So it's a very, very long journey that started with talking with one person, and you slowly have to walk up those stairs that more and more doors are opened for you.
Yeah.
In the later stages, when again we had our name and our positioning and brand in the market more much stronger, we started getting companies reaching out to us because they said, I heard that you had this impact with those companies. We would like to hear more. And the more, one thing that I didn't mention is the more companies, the more successes we had in the, with our partners, created more case studies, which were perceived as kind of more scientific, of course, and more operational. Using these case studies, we were able to get more and more and more audience.
Yeah, very good. I like the route. Obviously, this is the very natural route that a lot of salespeople have to take. Find a champion that is willing to listen and easier maybe to book a call with. Convince them that whatever they do, there is a better way. Obviously, they don't have decision making, they don't have budgets, right? And but what they do have, they have the connection to the person that you want to speak to, right? So they will then introduce, hey, my boss, speak to Nir, because what they were showing me is actually really exciting. And we have to earn it all the way up and up to the person that actually has got that decision-making buying power to really convince the person that really matters. Fantastic. Now, what are your plans for and goals for 2020? Do you think there are some big challenges for you guys in terms of your growth, going after new businesses and companies? We mentioned quite a few times NHS. Are you still, the goal is to take bigger chunks of NHS and introduce it to more departments or individual maybe offices? What's the goal and what are the challenges?
Yeah, so we are now leading our efforts in 3 different areas. One in Israel, to expand as much as we can, to expand both number of customers, number of calls, but also the impact of our technology. In the UK, to expand to more providers. And we also expanded to the pharmacy space. Again, the same idea. There are now services by NHS that are required from the pharmacy service providers. So use the same technology for pharmacists, online pharmacists, and outside of the UK and Israel to expand to more countries that have similar structure of the healthcare ecosystem and would be able to leverage and enjoy our technology.
Mm-hmm. Really cool. And I wish you good luck with this, obviously. I wish that you will be in every GP that there is here. So, because they have stuff, it's just the stuff what we discussed right at the beginning, right? They're just wasting 10 minutes between those things on manual tasks that could be in modern world automated. And what they do, they still work 8 hours, but it's just so much more productive. They actually just help people rather than clicking between the documents or spreadsheets or however they find it. So I wish you guys huge success in outreach and really educating companies and prospects and private and public sector on how AI can help more people. And in the industry, it's difficult to find people to work for them, right? That's what there was a challenge. Nir, listen, thank you very much for this. I hope that some listeners will be interested and possibly contact you. If they are, where could they find you online? Where's the best way? Is it your website? Is it maybe some social media? And we'll leave the link below.
Yeah, so we have both social media and our website, Ummanu. Yeah, and just look Ummanu Health in the Google Ummanu Health, and you'll be able to find us. We have the contact details over there. I can leave my contact details with you as well, and we'll be happy to spread our impact as broad as we can, because we really feel in Ummanu that we are using technology, using AI, using automation to do good. Yeah, to help patients with their challenges, and also help clinicians to serve more of the patients. And thank you, Pete, for this opportunity to talk about the impact that we had in Ummanu.
Beautiful. Thank you very much, Neil. I'm really grateful that you joined me, and I hope we can spread what you guys do, and hopefully someone that's connected to industry or in this industry in healthcare has listened to the end and will contact you. Yeah, thanks a lot. I really appreciate it.
Thanks. Have a great day.